Sometimes the summer means gorging on hot dogs and ice cream. They're both very good, but it can take a toll on your heart. Dr. Jamieson Bourque is here from the UVA Heart and Vascular Center to talk a little bit about what we can all do, aside from maybe just making this something we do every now and then, and aside from, you know, don't smoke and get exercise. What else can people do for heart health?
Thank you for having me.
Sure.
Certainly things like not smoking and exercising regularly are important. I would say particularly important is following a heart-healthy diet. So trying to eat a lot of fruits and vegetables, whole grains, moderate amounts of good fats like olive oil or lean meats, staying away from high saturated fats and processed sweets. So that's really important. Sometimes, though, patients have to do more than just watching their diet a little bit, and that's where kind of more testing comes into play.
Well, how much does your heart health depend on just your lifestyle versus maybe your family history?
So it really depends on what sort of genes you have. There's some patients who have particularly high risk family history and particularly high risk genes, and those folks need to have much more intensive treatment. Whereas someone who doesn't have those genes, it's really more the lifestyle that plays a role. But in everyone, it's really a combination of both.
So for those people who do have heart disease, what kind of treatments are you talking about?
So it really depends on their age and their gender and their risk factors. But talking about blood pressure control, cholesterol control, and sometimes patients may not be able to tolerate the medicines well, or they may not particularly want to take the medicines, and so there are additional things we can do to identify how aggressively we should treat them.
All right. Very important subject, Dr. Jamieson Bourque. Thanks so much for coming out here today.
Thank you very much.
Appreciate it.